Welcome to Triage Cancer's webinar, School and Cancer, Going to College. I'd like to introduce you to our speaker for today. Joanna is a cancer rights attorney and the co-founder and chief executive officer of Triage Cancer. Mrs. Duran has spent nearly 30 years working on behalf of individuals with cancer and has presented nearly 1,000 educational seminars on employment, insurance, healthcare, and advocacy issues. She also co-authored a book on cancer rights law for the American Bar Association called The Cancer Rights Law, an Interdisciplinary Approach.
Hello, everyone. Our goal today is to provide some key tips and understanding of things to think about when someone is going to college and also dealing with a cancer diagnosis. And so our agenda for this webinar is to provide some information about education rights, but to also talk about some of the things that are often forgotten about when thinking about going to school. So things that you need in college, like housing, parking, or special food requirements. What type of financial help might be available for paying for school? And also, students in college may also be working, and so understanding work rights that might be helpful. And we're going to talk a little bit about the issue of disclosure and health insurance that might create some changes for your needs when you go to college, as well as planning ahead and documents that you might need when someone is going to school. But I want to talk about language for a minute. So when we're going through this presentation today, I'm going to talk about students with cancer, and that might be students who are currently in treatment or students who have had a history of a cancer diagnosis. And generally, when you see the term AYAs, that means adolescents and young adults with cancer. And that's a pretty broad term because it could be an individual who's anywhere between 13 and 39, depending on the patient population we're talking about today. But as we talk about going to college, we know that some of you might actually be headed to college. Some of you might already be in college. Some of you might be parents of college-age students, or you might be a healthcare professional or an advocate who is working with students dealing with a cancer diagnosis. It's also important to keep in mind that some of this information is going to depend on where a student is at in the care continuum and where are they going to school. So is the student going out of state for school? Because if that student is still in treatment while in college, then we need to take into consideration how they're going to get ongoing care. And that might be about the type of care that they're getting. Is it care that they can receive somewhere else that still allows them to attend school? And then it's also important to keep in mind the challenges that life transitions bring. Going to college is a pretty big life transition, especially for students who are going to be away from home for the first time or for an extended period of time. And then you layer in a cancer diagnosis and potential side effects from treatment, and students may need additional support. And it might be a school counselor or a mental health care professional, like a therapist or a social worker that could be useful, or even all of the above to effectively support students through the transition to college. And then there are the things that we refer to as adulting 101, things that we should have learned in high school but didn't. And adulting is hard, navigating responsibilities and school, maybe work or insurance, finances, bills, and so much more. We're going to talk about some of those adulting topics today, but we have a lot of resources that provide useful tips and tricks, including a webinar on Adulting 101. Before we get into education rights, I want to talk for a minute about the medical challenges that AYAs may be facing. Different cancer treatments have different side effects, but there are some common challenges that are seen for AYAs that are similar to adults, but maybe have a different impact because an AYA's brain is still forming. And some common things that we see difficulties with are related to school. So things like an impact on handwriting or spelling, reading, vocabulary, math, concentration, and ability to complete tasks on time, memory challenges, processing difficulties. So it's also common to see challenges related to planning and organization or problem solving and even social skills. There are also non-cognitive side effects that AYAs might be experiencing, like fatigue, and physical effects related to the type of cancer and treatment that they've received. For example, a student might have hearing loss or a vision impairment based on their treatment, or an individual may have had an amputation that has had an impact on mobility and creates needs for accommodations. We also know that some side effects are acute and happen just for a short period of time, and some side effects can last longer. And we may see that some of those side effects occur during treatment, but also later after treatment's been completed. And we call those late-term side effects because they happen later. It can also be helpful for AYAs to receive a neuropsychological evaluation before receiving treatment to be able to assess how treatment affects some of these skills. But unfortunately, many AYAs don't receive this type of testing. And sometimes that's because there's time sensitivity in receiving treatment. Keeping those effects of a cancer diagnosis and treatment in mind, let's turn to education rights. And there are a lot of misconceptions about education rights, especially when it comes to going to college. And there are actually three main federal laws that apply to students that are different and overlap in some ways. Some people assume that it's the IDEA, or the Individuals with Disabilities in Education Act, that provides protections to college students in school, and that isn't entirely accurate. The IDEA is a federal law that governs how states and public agencies provide early intervention, special education programs, and other services to students with disabilities. And it requires that public schools provide free and appropriate education in the least restrictive environment. So many parents are familiar with the IDEA because it applies to students ages 3 to 21, but specifically only in kindergarten through 12th grade. And the reason why is because that allows for a student who is slightly older to have enough time to actually complete the 12th grade. And that's really useful for college or childhood cancer survivors who may need to miss school for longer periods of time while they're in grade school. So for more information about the IDEA, the Department of Education has a really useful website, which we've included on the slide. But this isn't what we're going to focus on today, because we're talking about the transition of going to college. And that brings us to Section 504 of the Rehabilitation Act of 1973. So this is a federal law that protects the rights of individuals with disabilities. And Section 504 specifically requires that school districts provide a free and appropriate public education to eligible students in their jurisdictions. So it applies to K through 12 schools, including all public schools. But it also applies to all colleges, universities, or even graduate schools that receive federal funding. Section 504 not only applies to public schools in that regard, but it also applies to most private colleges and universities because they're receiving federal financial assistance by participating in federal student aid programs. Now, the Rehab Act is a law that is actually broader than the IDEA because it has a broad definition of disability, and it applies to students with a physical or mental impairment that substantially limits one or more major life activities. So there's a few parts to that, so we'll break it down. This is for students who currently have a disability that is having an impact on a major life activity. And a major life activity is something major. So it's things like breathing, walking, talking, seeing, and the operation of major bodily functions. And those limitations on major life activities have to be substantial. They can't be minor or kind of annoying or just something that happens once in a while. It has to be a substantial limitation on a major life activity. So Again, the IDEA not only applies to individuals who have that current limitation, but also have a history of having that limitation. And that's very useful for students who've completed treatment. They're not being substantially limited anymore, but need access to some of these protections in going to school. And so they are able to tap into these benefits. It also applies to students who are concerned about being treated differently because of their medical condition. And that's where we see the IDEA protecting students who are being perceived as having one of those impairments, which really isn't about the student at all. It's about the school's perception of the student. So under Section 504, eligible students are entitled to receive what's called a 504 plan in writing, which is a plan that's created by the school to help students with disabilities overcome any potential challenges posed by their medical condition at school. And so effectively, it's a school plan to get access to accommodations. And we'll talk about accommodations in just a moment. All students at any age with a cancer diagnosis are eligible to receive services under Section 504. Then we get to the Americans with Disabilities Act, or the ADA. And some people are familiar with the ADA because of ramps into buildings or accessible parking spots, but the ADA is a broad law that has different sections called titles. And here, in the context of education, we're going to focus on Title II and Title III of the ADA. Title II protects individuals with disabilities from discrimination in state and local government programs and services. And that includes public schools, regardless of whether or not those entities receive federal funds. But it also covers publicly funded universities, community colleges, and vocational schools. Title III protects individuals with disabilities from discrimination related to public accommodations. And those can include a nursery, elementary, secondary, undergraduate, or postgraduate private school or other place of education, because those are open public accommodations. Now, the ADA doesn't apply to churches and private clubs, but it does apply to private schools. And under the ADA, a disability has a very similar definition to the Rehab Act, where a disability is a physical or mental impairment that substantially limits one or more major life activities. So first, you must have that physical or mental impairment. Second, it has to limit a major life activity. And third, that limitation has to be substantial. And when we're talking about cancer, often it's not the cancer diagnosis itself that creates the disability under the law, but usually it's the side effects from treatment that someone's experiencing that are impacting major life activities. And it could be that just one of those side effects could be a substantial limitation, or it could be that a combination of those things creates the presence of a disability under the law. Now, as you can see, things like concentrating and thinking and the operation of major bodily functions are things that are commonly substantially impacted by cancer treatment, which make it easier to show that someone with a cancer diagnosis does qualify for protection under the ADA and the Rehab Act. And when we look to see if someone has a disability under these definitions, we do it on a case-by-case basis. So we never say everyone with a vision impairment has a disability, or everyone with a cancer diagnosis has a disability. We look specifically to see how someone's medical condition impacts them specifically. So the ADA does apply to students who have physical or mental impairments that currently substantially limit one or more major life activities, or to students who have a record of having that impairment, or students who are being perceived as having that impairment by their school. And under the ADA, not only are students protected against discrimination, but they're also entitled to receive accommodations in the school and related to school. Let's talk about reasonable accommodations for a minute. So we have grouped them into 3 categories of common types of accommodations that are useful to students at school. And some of these are going to be more relevant at certain schools. So if a student is going to a campus at a small school versus a large school that's spread out over acres or even city blocks, the needs might be different. But the first category of reasonable accommodations that come up at school are around modifying space. So maybe a student needs to sit in the front row so that it limits distractions in the classroom and it helps them with focusing. Or maybe that it's a student needs to have access to a classroom that is on the first floor because the building doesn't have an elevator. Or maybe it's about special furniture requests or ensuring that someone has access to housing that is closer to the location of their classrooms. It might also be about modifying schedule. So if a student needs extra time to get in between classes or additional time to take tests or complete assignments, in some cases it might be about actually taking an extended leave from school in order to get access to treatment, but being able to return at some point without having to reapply to the school, for example. Then there are this category of other options that are sort of a catch-all for everything else. So it might be utilizing technology or having a note taker in class or being able to record classes where normally students aren't allowed to record classes. It might be about having access to online classes or being able to take tests orally as opposed to written tests. There might be exceptions about course load, being able to take fewer classes a semester while still maintaining full-time student status. So there are lots of aspects of going to school that might be able to be adjusted or accommodated with changes to help a student be successful at school. And these are just some examples of accommodations that might be helpful. It is important to keep in mind that schools do have to accommodate eligible students with disabilities, and that those accommodations actually have to be reasonable and effective. So if an accommodation is being offered that doesn't actually work for the student and isn't effective at helping that student be successful at school, it's not a reasonable accommodation. And it's important to keep in mind that reasonable accommodations are not limited to one. A student doesn't just get one and that's it. If someone has multiple side effects or multiple needs for accommodations, different types of accommodations might be useful. So maybe there's an accommodation related to having a note taker, but also being able to attend class remotely. So being able to get access to more than one accommodation allows someone to address more than one need that is arising from their medical condition. And someone's needs might change over time. If a student going to college is starting college in their first few months while they're still in treatment, what they might need then could look very different than what they might need 6 months from then. And so it's important to keep in mind that reasonable accommodations can be adjusted over time to make sure that they continue to be effective for students. So to give you an example, Catherine is a young adult cancer survivor, and she finished active treatment 2 years ago. She's now trying to get her college degree and fulfill her dream of becoming a counselor. For the first time in her life, she's struggling in school and she's missing deadlines and getting poor grades. And she just feels like she isn't back to normal. So what are Catherine's options? What types of accommodations could she ask for? First, she needs to think about what is causing her to struggle in school? What's causing her to miss deadlines where it's also resulting in poor grades in her classes? Does she need help taking notes in class? Does she need more time to complete assignments? Maybe she needs a tutor to help better perform in school. We don't know enough here to be able to provide more recommendations, but the key is that she could potentially get accommodations, then can help her actually be successful in school and get back on track. So then the question becomes, who do you ask for a reasonable accommodation? And the answer is, it depends. You could ask a professor directly, but not every professor is going to understand that you're asking for an accommodation, or frankly, understand that they're obligated to provide you with an effective accommodation. You know, some professors might react where they don't like the idea of you recording a lecture, but would be willing to provide you with a note taker. Or they may not want to extend deadlines for you because they don't understand your need for an accommodation. So that's where you might need to go to the school administration for help. There may be also situations where students don't want their professors to know about their need for an accommodation to protect their privacy. So going to the school administration instead, and that the only thing that the professor knows is that there's a note taker, but not even for which student in class, is something that could protect a student's privacy. On the other hand, a trusted, supported professor can also advocate on your behalf with the school. And so really, the answer is it depends, because it's going to depend on your individual situation and what your comfort level is and what your priorities are. Most colleges and universities are going to have a department that is specifically there to help students with disabilities. And that might be called the Office for Students with Disabilities. But there's a couple things to keep in mind. Students with cancer or a history of cancer often don't think of themselves as having a disability. But here, the laws that provide protection are broad, and they can include cancer in their definitions of disability. And so we don't want students who might qualify for services to get hung up on the name of the department where they're going to for assistance. And again, these departments might be called different things. There is a resource called the National Center for College Students with Disabilities that actually has a very useful tool called the Campus Disability Resource Database, or CEDAR. And this database actually has a list of all the schools that have specific offices for students with disabilities. And so I apologize for the typo on the slide, but the website is cedardatabase.org. So when you're thinking about a need for a reasonable accommodation, this is a short checklist or a cheat sheet to think about accommodations. So first, students really need to think about, what's the thing that's causing a challenge? Is it a specific side effect from treatment? Is it a scheduling challenge? If someone is still in treatment? But thinking about the thing that's challenging, how is it a challenge at school? Is it something that's just generally challenging about life, like short-term memory loss? But how is that challenge specifically affecting someone at school? And then, is there something that would make it better? And the law allows students with disabilities to be as creative as possible. So the law allows for any type of adjustment that is reasonable and effective for a student to help that student in school. And then once you've figured out what's challenging and if there's something that can make it better, to make that list as long as possible, all the potential things that can make it better, then you can figure out what your preferences are and then request those as accommodations. And remember that these are things that you're asking the school to do. Where can the school provide things that would make it better? And even if you have a long list of accommodations that could be possible to help, a school doesn't necessarily have to give you all of them. That's why it's good for you to make an extensive list and to prioritize it. So what you think would be the best options that would be effective, but the requirement is that the school does provide you with an effective, reasonable accommodation. And then we get asked often, do you have to get an accommodation in writing? And the answer is no, you don't have to, but it can be very helpful. because it creates a record for what you've asked for and what was provided. So maybe you're in class and the professor has allowed you to record the lecture. But then one day, the professor is out and there's a guest lecturer and you're recording, and the guest lecturer doesn't want you to record and sees that you're recording and gets upset. So having a record of the accommodation that you've been provided might be helpful in that situation so that you can explain to that guest lecturer that this is something that's being provided to you as an accommodation. So it can just help with communication and provide a record of what you have been given as an accommodation. Now, it's important to remember that when we're talking about side effects, there are side effects that can actually be helped by working with your healthcare team. So maybe there is medication to address side effects, or maybe access to complementary therapies that can help you address your side effects that will help you deal with them at school. There's also practical things that students can do to address some of their side effects. So maybe it's about utilizing technology and setting reminders and kind of decluttering things so that there is a better ability to focus on school. So those are just sort of practical tips that students can do on their own. But when we're talking about accommodations, those again are the things you're specifically asking the school to provide that helps a student in school. There is also some things to think about when preparing for college. So before you've gotten to school, thinking through what might be a challenge when you're at school, how might it be a challenge, and is there something to actually make it better? And then figuring out ahead of time who you can ask for an accommodation. So doing that research on what the school might be able to provide, but then also who's going to provide it. So you can do the research on the Office for Students with Disabilities and go in and make an appointment before school starts to talk through what it is that might be a challenge for you, and then also what they might be able to provide to help address those challenges. There are also the potential for reasonable accommodations in the college application process. Generally speaking, the laws protect people against discrimination in the college application process for students with disabilities. There are also some protections around disclosure. Individuals applying to college do not have to disclose their disability status during the application process. But if students know that they'll require accommodations, they can choose to disclose their disability or wait to identify what types of accommodations they might need once they start school. If a student does disclose their disability, the school isn't allowed to deny a student admission based on their disability. Also, the college application process includes things like completing applications or taking entrance exams or placement tests, and potentially even interviewing at schools. And eligible students may be able to access accommodations at different points during the college application process. For example, students who are taking College Board exams can request a variety of test accommodations. And if you're requesting an accommodation for a College Board exam, they have a specific calendar of deadlines for when you need to apply for specific tests that sometimes have a different schedule than normal tests. So if that's something that you feel like you need, it's important to look at that calendar ahead of time. But there are other college needs that a student might have. And it's important to kind of think through your other needs related to college. So if you are commuting to school, what does the parking situation look like? There are plenty of places in the United States where parking is a challenge. And so trying to identify your ability to have a reserved parking spot or making sure you are able to get a parking pass for the lot at all might be accommodations that you need at school. Is there a specific need around food? So Is there a meal plan at the school? Does a student actually need special meals? Or maybe there's a need for a nutritional assessment. So if a student actually needs that nutritional assessment, there are organizations in the cancer community that actually help provide that. So the Leukemia and Lymphoma Society, for example, can connect someone to a nutritionist. There might also be a need around housing. So if a student is living on campus, what does that housing look like? Is there a need for an elevator or maybe a ground floor? Is there a need for housing that's closer to classes? Or in some schools, it's actually difficult just to get on-campus housing. So maybe getting on-campus housing is an accommodation because you're not able to commute. Do you need a private room because of a compromised immune system? Do you need access to a fridge because of needing to refrigerate medications or food and dietary requirements? And then if someone is living in off-campus housing, it may also be helpful to understand your housing rights. And we have some resources at Triage Cancer that can provide information around housing. On cancerfinances.org, we have a module on housing rights, which talks about the laws that protect people in housing based on their medical condition. And we also have a quick guide to reasonable accommodations and modifications in housing. Reasonable accommodations exist in lots of different ways. At Triage Cancer, we often talk about reasonable accommodations related to work. So we have a number of resources available to help people think through what might be helpful. Turning to financial resources that might provide financial help for education while people are in school and sometimes after school, there are financial assistance programs on our cancerfinances.org website under financial assistance resources, as well as under the education rights module on Cancer Finances. I do want to mention that federal student aid is a primary way where people get financial help to go to college and to graduate school. And studentaid.gov is the main resource to find information about student aid. You can find financial aid programs. If you already have loans and are trying to find information, you can do that on this site. And then you can also manage your loans after school. For just a minute, I'd like to talk about two things related to finances and student loans that someone might not need until they're in college or maybe even done with college and dealing with a cancer diagnosis and treatment. But I know that we have a diverse audience on today, and I want to make sure that people are aware of these resources in case they qualify. If someone has a federal student loan and needs to pause their student loan payments while they're in treatment, there is an option specific to the cancer community. Borrowers with direct loans, FFEL program loans or Perkins loans programs, which either were made on or after September 28th of 2018 or had entered repayment on or before September 28th of 2018, may qualify for a deferment while they're in cancer treatment and for 6 months following the conclusion of treatment. So I know that's very specific details, which is why we've included all of that information on the slide for you. We've also included a link to where to go for information, but it is on that studentaid.gov website. There is also something called total and permanent disability that allows someone to discharge their loans if they have a disability. And it only applies to certain federal loans, so direct loans, the FFEL loans, Perkins loans, and TEACH grants. But if someone has a disability where they're a veteran with a service-connected disability or receiving SSDI or SSI, they can actually discharge their student loans. There may also be private lenders that offer disability discharge options. They all have very different rules, so you have to contact your specific lender for details about that information. And then the last thing that I want to mention is that during COVID, there was a pause on student loan payments. And because the pandemic has ended officially, the student loan pause has restarted, and that student loan interest will resume on September 1st, and payments will be due starting in October. And so if you're in a situation where your student loans were paused, we want you to be aware that they are restarting. And that if you have questions about how to prepare for those repayments, all of that information is on studentaid.gov, and you can look at the various tools that are available to help you. And if you are feeling like you are not going to be able to make payments, talking to the Department of Education about your options for adjusting your loans is a good idea, as opposed to just not making payments, because then you might lose out on some of the options that could help. Now, I mentioned that some college students may be in a position where they're also working while they're going to school, or even have a work study requirement for their financial aid package. So I want to talk for a minute about employment rights. And there's actually a lot of places to go for information about employment rights. There are laws that we call fair employment laws that protect people against discrimination in the workplace based on their medical condition, and also give them access to reasonable accommodations. And we'll talk more about those in just a second. And those laws exist at the federal level, like the Americans with Disabilities Act, or ADA, but they also exist at the state level. And I think it's important to remember that you can't just know what's available at the federal level. You have to look at the state level too, because sometimes that's the only thing that you have access to. And then there are laws that we call leave laws that allow you to take time off work, and they provide some job protection and maybe even health insurance protection. And again, those laws exist at the federal level, like the Family and Medical Leave Act, or FMLA, but they also exist at the state, county, or even city level. And then we forget that sometimes we work under an employment contract. So for people who are in unions, those union bargaining agreements are going to provide additional information about whether or not they have access to certain benefits and protections. And a good example of this is where students are working at student unions in college. They're actually a member of those unions, and they have access to some protections under those union contracts. And then it's important to remember that the law just provides a bare minimum of what employers have to do. There are many employers that go above and beyond and provide additional benefits and protections. And so we need to look at those specific employer policies. And those can typically be found in some version of an employee manual or handbook. And if you work for an employer that doesn't have this, you can certainly ask whoever you turn your timesheets into, or if there's an office manager or the owner of the company who can answer questions about these types of benefits. So we want to look to see, does someone have access to different types of insurance coverage, like health insurance or disability insurance or even life insurance? What are the rules around taking time off work? Is there vacation time or sick time or just general PTO time? Can coworkers donate their hours to you to be able to take time off work? All of those things are going to be specific to an employer's policies. And these are just some things to keep in mind for students in college who are also working. Now, the ADA is a law that we talked about in the context of providing protections at school under Title II and Title III. But the ADA also applies to employment under Title I. And Title I of the ADA allows you to use the ADA in 4 ways when we're talking about work. So it applies to employees who currently have a disability. It applies to employees who have a history of having a disability. And then it also applies to employees who are being regarded as having a disability by their employer and are being treated differently because of it. It does also apply to caregivers. under the ADA. So caregivers who are employees are also protected against discrimination in the workplace because of their caregiving status. And the ADA applies to all phases of the employment process. So it applies to job applicants as well as employees. And it does provide that protection against discrimination, but it also provides access to reasonable accommodations for individuals who currently or have a history of having a disability. So really the bottom line of the ADA's employment protections is that an employer can't take into consideration someone's medical condition. Now, I want to talk for just a minute about disclosure, because one of the most common questions for patients in the area of work and cancer is, do I have to tell my employer or potential employer about my cancer diagnosis? And the same question exists for a student going to college. Generally, you're not required to disclose your medical condition to an employer, except if you want to access certain protections, like reasonable accommodations. But even if you want to access a reasonable accommodation, in that circumstance, you need to share information about your medical condition that provides enough information to justify your need for that reasonable accommodation, but it may not be necessary to disclose a specific cancer diagnosis. Because most of the time the need for accommodation is because of a side effect, which can often be talked about with ever tying that side effect back to a cancer diagnosis. So I do just want to mention, in the same way that disclosure is a choice and there are privacy protections when it comes to school, the same thing exists in the area of work. And so understanding your rights to privacy and your choices around disclosure is something that we have resources to help you figure out so that you can make the decisions that are best for you. Disclosure is a very personal decision that individuals have to make for themselves, and they should decide who they disclose to, how much information to disclose. But the reason we think disclosure is an important thing to make a conscious decision about is because it can have a lasting impact. We hear stories of people making decisions at the time because they think that that's what they need to do, but then regret those decisions later on. And so we want people to think about what their actual preferences are and understand their rights, again, so that they can make the best decisions for themselves. But there are some places where we see inadvertent disclosure. And obviously, social media is a common place for that. But I do want to specifically mention crowdfunding for a minute. Many families feel like they have to resort to crowdfunding to help pay for the cost of care, or even to pay for school, given the financial challenge that cancer brings to a family. And crowdfunding can be a very useful way to have others provide support. However, there are some downsides to crowdfunding, and one of those is where those crowdfunding sites have someone's name and medical condition, and then it is something that can be Googled. And so to think about how those crowdfunding opportunities are set up, if someone is concerned about their privacy, is something important to think about. The other thing is that if someone is eligible for government benefits that are based on income level, like access to SSI or Medicaid, for example, that those benefits could be impacted by any money that someone receives from a crowdfunding campaign. And there are ways to set it up in a way that it won't have a negative impact. And we have a quick guide to crowdfunding that provides tips on how to actually do that. Turning to health insurance when you turn 18, I want to just bring up some of the things to think about where there might be situations where your insurance options actually change. So under the Affordable Care Act, there was a requirement that individual and employer-sponsored plans cover young adults until they turn age 26. There is no longer a requirement that those students be full-time students or dependents under IRS standards in order to get access to that insurance coverage. It's just based on age. Even if that young adult is married, they can still stay on their parents' health insurance plan. And so that created a lot of opportunity for those young adults to keep access to their health insurance coverage. Now, there might be situations where your state Medicaid program has different rules for when you turn 18. Some Medicaid programs will allow students to stay on Medicaid until they turn 21. Some stop at 18. So understanding your state-specific rules about how your age is going to impact your eligibility for Medicaid is very important. It's also good to understand your state health insurance marketplace, and that is a place where you can find private insurance options that may be less expensive than maybe staying on a parent's plan. If that young adult is looking for coverage in the same state where they live, or maybe if they're going out of state for school, looking at a marketplace plan in that state might be useful. And then if a student is working, does their work plan provide health insurance coverage? So then the question becomes, well, how do you pick if you do have multiple options for health insurance? Unfortunately, when we talk about health insurance, most people are not familiar with our healthcare system and how health insurance works. And I used to just say that sort of anecdotally based on my experience, but now there's data to back it up. Only 4% of Americans could actually define the 4 key terms used in health insurance. So it's not surprising that only 40% of Americans said that they're very confident that they can choose the right health insurance plan. And we want to make sure that everybody actually knows these terms so that they can be effective in picking a health insurance plan that is beneficial for them. But when we talk about picking a health insurance plan, there are lots of things that we buy as consumers that we spend lots of time figuring out, making those purchase decisions. So if we're buying a new computer, the average time spent is 4 hours. If we're buying a car, it's 10 hours. If we're planning a trip, it's 5 hours. But would you believe that only 15 minutes is what most Americans spend on picking a health insurance plan? And obviously that can have a huge impact on what you're paying for that health insurance plan. So when we're talking about those 4 key terms that are used in health insurance, there is actually one more that we want to mention, and that's your premium. That's what we pay each month to have health insurance. Even if we got no medical care during the year, we would still have to pay our monthly premium, which is a fixed dollar amount. But then there are those costs that we pay when we use our health insurance and get medical care. And the first is our annual deductible. It's what we have to pay first before our health insurance coverage even kicks in. And it is a fixed dollar amount. So you might have a $50 deductible or a $500 deductible or a $5,000 deductible, depending on the plan that you have. And then there's something called a copayment. And this is a fixed dollar amount that you pay each time you get certain types of care. So you might have a $10 copayment for visiting your primary care physician, or it might be a $50 copayment to see a specialist, or a $500 copayment if you're going into the emergency room. And that's different from coinsurance or cost share. Those are 2 terms that mean the same thing. And it's a percentage. It's the difference between what insurance companies pay for our medical expenses and what we pay. So if you have an 80-20 plan, the plan is going to pay 80% of your medical expenses and you're responsible for 20%. And then probably the most important thing that anyone should know about their health insurance coverage is their out-of-pocket maximum, which is a fixed dollar amount that is the most that you're going to pay out of pocket for your medical expenses during the year. So in a worst case scenario, it's the most that you're going to pay. And the way that you reach your out-of-pocket maximum is actually a math problem. So you add up what you pay for your deductible, plus your co-payments, plus your co-insurance amounts to help you reach your out-of-pocket maximum. And when you do reach your out-of-pocket maximum, then your insurance kicks in at 100% for the rest of the year. So to give you an example of how this works, Dan has a plan that has a $2,000 deductible. It's an 80-20 plan, and he has an $8,000 out-of-pocket maximum. He has been in a car accident and he spends a week in the hospital, and he walks out with a $102,000 hospital bill. Assuming Dan's had no other medical expenses during the year, what does he actually have to pay of that hospital bill? So first he pays his $2,000 deductible, which leaves $100,000 left of that bill. And then the insurance company is going to pay 80%, and he's responsible for 20%, which is $20,000. But how much does he actually have to pay of that $20,000 bill? Well, he's already paid $2,000 of his deductible, and he has an $8,000 out-of-pocket maximum. So he only has to spend another $6,000 of that $20,000 bill, and then he'll reach his out-of-pocket maximum. So then his insurance will kick in and pick up the rest of that $20,000 bill. Now, I'm not suggesting that $8,000 isn't a lot of money, but at least there's a cap on what he would have to pay. If there wasn't a cap, then he'd be responsible for that full $20,000 bill of his coinsurance amount. So what I explained in those terms and this example is actually in one of our animated videos on health insurance basics. So if it's something you'd like to see again or share with others, that is something that you can share. But there are details, and the details matter. You have to understand how out-of-pocket maximums work for your specific plan. If you have a marketplace plan, the out-of-pocket maximum is the most protective. It's going to include deductibles, co-payments, co-insurance amounts, both for any medical care that you receive and your prescription drug coverage. And so that's very protective. But some employer plans are allowed to carve some things out. They can carve out deductibles, or they can say, we don't want deductibles or co-payments helping you reach your out-of-pocket maximum. Or maybe we're going to give you a separate out-of-pocket maximum for prescription drug coverage. So you need to understand specifically how out-of-pocket maximums work for your plan so that you know what the most is that you might have to pay for your medical care and your prescription drugs during the year. Now, the one other thing that is incredibly important to understand about health insurance coverage is that if you have an HMO or a PPO, that those plans contract with specific providers, and those providers are referred to as in-network providers. They're in the network of the insurance company. And those providers agree to receive a specific allowed amount or a contracted amount for different types of care. So they're contracting with the insurance company to say, we'll accept X amount of dollars for this particular type of care. There are also some terms related to prescription drugs that we want people to understand. And the first is the formulary. The formulary is the list of drugs covered by a particular plan. And the formulary is broken up into different levels that are called payment tiers, which are going to determine how much you actually pay for different types of drugs. So this is just an example of what a formulary tier could look like. So at tier 1, you have your cheapest generic drugs. So maybe an antibiotic where you only pay $5 to pick up that prescription from the pharmacy. The tier 2 drugs are more expensive generic drugs or preferred brand name drugs, and there you're paying $25 for a copayment. And then at tier 3, there are more expensive and non-preferred brand name drugs where you might pay $100 copayment per prescription. But most of the time when we're talking about cancer care, those fall under the specialty drug tier, where you're not paying a copayment, but you're paying a coinsurance amount. So you're paying a percentage of that drug cost, which can definitely make a difference in how much you're actually paying for your drugs because it's a percentage rather than a fixed dollar amount. In the United States, there's only 3 places where we get our health insurance coverage. We're either getting it directly from an insurance company, or we're getting it through the government. And by that, I mean Medicare, Medicaid, military or veterans plans, or state or local programs. But about 50% of people in the United States get their health insurance coverage through an employer. So when we're talking about options for student health insurance coverage, there are different lanes that those students can drive down. They can continue on a group health insurance plan, whether it's a parent's plan or a work-related plan through their employer. They could also look at a marketplace plan, whether it's in their home state or if they're going away to school, they might choose a marketplace plan out of state to make sure that any care that they're still receiving is covered in that state. And then there might also be a student health insurance plan that's offered by the school. And it's important to note that the Affordable Care Act actually requires student health insurance plans to be full scope health insurance plans. That wasn't a requirement before the Affordable Care Act. And so these plans may actually be good options to cover all of a student's medical care. And then a student might also be eligible for Medicaid based on their household income level. And so that is another option for a student to take a look at to get access to health insurance coverage. So I raised the question earlier, how do you actually pick between these options? And I'm going to walk you through an exercise that is used to compare plans. So it might be that you're comparing different marketplace plans. If a student has access to an employer plan, but the employer actually gives you options to choose from, you could compare the marketplace to an employer plan. And then, not necessarily applicable to students in college, but Medicare Advantage plans can also be compared using this exercise. So here we have 3 plans. There's a bronze level plan at $200 a month with an $800 out-of-pocket maximum. A silver plan at $275 a month with a $6,000 out-of-pocket maximum, and a platinum plan at $400 a month with a $2,000 out-of-pocket maximum. Can you tell just by looking at these plan options, which is actually going to cost you the least by the end of the year, assuming that you are going to hit your out-of-pocket maximum? Because when we talk about the cost of cancer care, that likelihood is pretty high. The answer is no, you absolutely cannot look at them and just decide which one is going to be cheapest. You actually have to do the math. And the way that you do the math is that you take the monthly premium and you multiply that by 12, and then you add that to the out-of-pocket maximum, because that's going to be the total amount of the cost for the plan for the year, plus the amount that you have to pay out of pocket for your medical care. So having done the math here, you can see that the platinum plan ends up being a couple $1,000s cheaper by the end of the year, even though we look at that monthly premium and we get a little bit of sticker shock. And most people, when they're shopping for health insurance, are only looking at monthly premiums when deciding how to pick a plan, because they don't know how out-of-pocket maximums work. And so that's why it's so valuable to do the math to figure out what the plan is really going to cost you by the end of the year. There are other differences between the plans that it's important to take a look at. So it's not just based on cost. You also need to make sure that the plan actually covers your providers and your facilities, to make sure that those providers and facilities are actually in that health insurance plan's network. Because if they're not, you're going to pay more to see those out-of-network providers. And the same thing with prescription drugs. You want to make sure that the drugs that you're taking are covered on the plan's formulary, because if they're not, then again, you're going to pay a whole lot more for those prescription drugs because they're not on the formulary. There are some tools that are available to actually help us do this as consumers. And if you are shopping for health insurance coverage on healthcare.gov, which is the federal marketplace, you can actually look at the doctors and facilities and drugs that are covered by a particular plan. We do have a lot of resources to help people understand how to pick a health insurance plan. So we have an animated video on picking a plan. We also have worksheets to help people do the math. So if you're comparing two different plans and you need help figuring out the cost differences in those plans, we have worksheets to help you do that as well. So I want to turn to some other things to think about when turning 18, where a student might be going to college that often aren't discussed at all, especially in the context of education. So once someone is legally an adult, usually at 18 years old, a parent's legal rights to access a child's medical, financial, and educational records becomes limited. Before a child turns 18, it's important for parents to talk to their children about the information that they may need to access. And this can be especially important if a child is still receiving cancer treatment. And so we do actually have a checklist on turning 18 that can help parents and children start that conversation. But for the parents who are on today, it's important to remember that your child may have different preferences related to these topics than you have. And that's why you really do need to have a conversation. But for the students who are on today, it's important to think about why it might be beneficial for your parents to still be able to access some of this information so that they can effectively support you. So I want to start with communication with healthcare providers and accessing medical records. So what medical information can a parent access once a child has turned 18? HIPAA, or the Health Insurance Portability and Accountability Act, actually prevents healthcare providers from disclosing an adult patient's medical record, their health status, any treatment plans, unless they've received the patient's permission. So if a student wants their parent to still be involved in their healthcare or have access to their medical records or be able to talk to their healthcare team, then parents and kids actually need to sign a HIPAA authorization form. And those forms can be obtained from healthcare providers, or you can also find a sample form, a HIPAA form, in our estate planning toolkit on our website. And then with respect to hospital visitors, for students who would like their parents to be able to visit them in the hospital, or have others that they want to be able to visit them in the hospital, they can actually complete a hospital visitation designation form at their hospital to specify who is allowed to visit them. Now, this often comes up in situations where there are individuals where patients don't want them to visit. And that is important information to communicate if patients feel strongly about that. There are also things that parents need to think about and students need to think about making medical decisions. There may be a time when a student is unable to make their own medical decisions, for example, if they're unconscious. And an advanced healthcare directive allows a student to document their choices. And so there are two key parts to an advanced directive. There is a section for healthcare instructions where they can write out specific instructions related to their healthcare preferences. But there's also something called a healthcare power of attorney, or a proxy, or a healthcare agent. And that's where a student can name another person to make healthcare decisions for them if they're unable to make their own healthcare decisions. And this is a good document for anyone who is over 18 to have if they want to appoint someone to be able to make those medical decisions if they can't speak for themselves. Again, we have state-specific advanced healthcare directive forms in our estate planning toolkit on our website. And then turning to finances, there may be a time where a student is unable to take care of their own finances or may need help. And a power of attorney for financial affairs allows a student to choose a trusted adult to make financial decisions for them, or in case they aren't able to make those decisions themselves. Again, for example, if someone is incapacitated, who can do things like pay rent or receive mail or talk to an insurance company. All of those things, when a child turns 18, a parent can't automatically do those things for a child. Adult child needs to give their parents permission to be involved in those types of decisions. So when a child turns 18, if they need assistance with taking care of their finances, then they could name a parent as a power of attorney for financial affairs. And again, we have those state-specific forms in our estate planning toolkit. And then the last thing that I want to mention is about communicating with schools and accessing school records. So if a student wants their parent to have access to their educational information, once they turn 18, the Family Educational Rights and Privacy Act, or FERPA, requires that students provide written consent for the release of their school records to parents. And so if a student is trying to negotiate accommodations with the school, for example, and wants their parents to be involved in that negotiation process, making sure that a FERPA release form has been completed so that the school can communicate with the parent can be a helpful tool as well. And then I do just want to mention that there are other useful tools that might be helpful for students, especially if they're going away to school. So on a smartphone, there is a place to put in emergency information where there's contact information and things like allergies or medications that a student is taking that can be helpful to emergency personnel in case of an emergency. You can also include information about the existence of advanced planning documents on that platform as well. And the platforms depend on what type of smartphone that you have, but they all have them. There is also jewelry that exists that can communicate medical information in case of an emergency. And so that might be something to take into consideration for students who are going to school. And then the last thing that I want to mention is around estate planning and medical decision-making, generally speaking, because I think that no one really likes planning ahead and preparing these documents or thinking about mortality. But when someone turns 18, it's important to document that information for everybody, regardless of dealing with a serious medical condition. And I have mentioned a few times that we have a state-specific estate planning toolkit, which provides comprehensive information about all of the potential estate planning documents that families and students might want to consider having in place, as well as state-specific information and the forms that are available in each state. And so that is a free tool that we have available to people. And then I mentioned that a lot of these adulting topics are not things that anyone really likes to deal with, like picking a health insurance plan or estate planning documents. But we know that lots of people learn in different ways. And so we have a lot of this information on our website, but we also cover a lot of this information in our animated video series. These are 5-minute videos, which cover some of the things we think are most important for people to know. Including topics around estate planning and even practical things to think about, like how to deal with your electronic files or your pictures or your music. So that is information that is covered there as well. I also want to mention a resource called Connecting Champions, which is a partner of ours as an organization. And this is an organization that actually connects adolescents and young adults who've been diagnosed with cancer with potential mentors in their field. So for students who are going to cancer and want to be connected with a mentor, that this is an organization that will help them do that. So that they can be clear about finding a future career path and be successful in their future careers. So at this point, I'm going to take questions. And there is a question about any resources for free medical bracelets. And I actually don't know of any resources that provide free medical bracelets, but we often suggest to people when they're looking at their finances and they're looking for financial assistance to think as broadly as possible for that financial assistance. So if someone needs a medical bracelet and can't afford it, maybe they qualify for utility assistance, for example, and they could use that utility assistance money that they're saving to be able to pay for a medical bracelet. So if you are looking for financial assistance options on cancerfinances.org, we have a module on financial assistance resources, and that is actually broken down by type of financial assistance. So you can search there to look at potential programs that you might qualify for, and those include cancer-specific scholarships. So there are many organizations within the cancer community that provide scholarships related to cancer. So some of those are for students who have a cancer diagnosis. Some of those are for the children of individuals who have cancer. So you have to look specifically at those programs' requirements. And there was a question about, in the comparison of plan choices, which plan actually was going to cost the least by the end of the year. And in that case, it was actually the platinum level plan. But it's important to remember that that isn't always the case. It's just based on how that math of those options turned out. So that's why it's so valuable that regardless of what options you have available to you, that you actually do the math to compare those options so that you know which is actually going to cost you the least by the end of the year, instead of just looking at the monthly premium only. And there's a question to ask me to share again the resource. It's cancerfinances.org, which you can also find on our website at triagecancer.org. And then you can go to the tab of resources, and then it's listed there under resources. And then there's a question about, as a young adult, how are your Medicaid insurance options affected if your parents claim you on their taxes as a dependent? And that does actually have an impact, because if your parents claim you on their taxes as a dependent, then they're looking at the household income to determine whether or not you qualify for Medicaid. And so, for example, if both parents are working, it might kick you out of income eligibility as a young adult in trying to get access to Medicaid. So there might be some value in having a conversation as a family to figure out if it would be more effective for the parents not to claim you as a dependent and to actually be able to get access to Medicaid, especially if you're going away to school and are claiming or filing taxes yourself. So I think that's, oh, there's one more question. So if we have questions about wanting to remain on the same insurance as our parents, but are turning 26, what would be the appropriate steps to take? So first, you would want to look to see what your other options are, and then look at the coverage that your parents' plan offers, because when you turn 26 as a young adult on your parents' coverage, when that coverage ends, you would be eligible for COBRA. So you could keep that same coverage for an additional period of time. And in most cases, if you qualify for COBRA and you are aging out of your parents' plan, you can keep COBRA coverage for 3 years maximum. So in order to figure out if that's actually your best option, you need to know your other options. So maybe looking to see if you qualify for Medicaid or if you have marketplace plans that you're eligible for, and then to compare those options to see which would provide you the best coverage. Does it cover your providers and your prescription drugs? What are your out-of-pocket costs going to be? What's the out-of-pocket maximum? So those are all things that you would take into consideration in figuring out, is staying on my parents' plan through COBRA a good option, or are there better options available to me not only in coverage, but maybe in cost as well. So I believe that's all of our questions for today. So I'm going to turn it back over to Sophia.
Thank you so much, Joanna, for that wonderful presentation. And I would like to remind everyone that a recording of this webinar will be made available on our website soon. I dropped the link in the chat. And you can also navigate to our website, click on the Events tab, click Past Webinars, and then you'll see our full archive of webinars, as well as resource documents pertaining to each topic. So we hope that you enjoy this webinar. And to close, we would like to emphasize that this isn't your last chance to learn with Triage Cancer. So if you're interested in learning more about today's topic or the topics on the screen, we invite you to attend our Apex event, the Triage Cancer Conference. We offer this day-long event biannually and free of charge to anyone in the cancer community. We cover key information on how to navigate practical issues, minimize the financial burden of a cancer diagnosis, and how to reduce stress. And we also provide free contact hours and continuing education credits for healthcare providers. And for the healthcare professionals on today, we greatly appreciate the role you play in changing the lives of those impacted by a diagnosis. And we also recognize just how vast all of this information is. So to meet this need, we created a day-long insurance and finance intensive just for you. This training is free of charge, and it takes a deep dive into health and disability insurance, employment, and finances. This program also provides free continuing education credits for healthcare providers, and we will be offering the virtual training once more this year on November 8th. And as a reminder, if you have any questions about your individual situation, or if you have questions related to this webinar, you can contact our free legal and financial navigation program by filling out an intake form online and scheduling an appointment with our staff. So we hope that you will continue to stay connected with Triage Cancer. We invite you to attend more webinars and other events. And I will also drop the link to our Flower Power fundraiser in the chat right now. And we encourage you to sign up to receive our blog and connect with us on social media. I personally really like our blog because you can use the QR code on the screen to sign up, and then it just pops up into your inbox. And you don't need to remember to check our website for important news related to the cancer community. And for the healthcare professionals on today, or people looking to distribute materials to their communities, you can use the materials request form to order printed materials in bulk, and we will ship them to you for free. And as a last reminder, in order to receive continuing education credit for today's webinar, you must have stayed on until the very end. You will receive an email tomorrow from Zoom, which will contain a link to the evaluation and the post-test. The evaluation requires your name and your email address so that we can verify you completed the evaluation and attended the entire webinar. And that is also the email we will use to send the certificates within 4 weeks. Please complete the evaluation and the post-test within 1 week of this webinar. And for the nurses and social workers on this call, you must also receive a passing grade of 80% on the post-test in order to receive credit. And on the next screen, you will see this message. If you've completed the evaluation and the post-test and you pass the post-test, there's nothing else you need to do, and you will receive your certificate within 4 weeks of today. And if you receive a score that is less than 80%, you will see this message, and it will include the link to retake the post-test. All you need to do is copy and paste the link into your web browser. You don't need to resubmit the entire evaluation, just the post-test. And if you're having difficulty accessing the retake, please email info@triagecancer.org and we will help you. Thank you all so much for attending today. We hope that you found the information valuable, and we hope that you all have a great rest of your day.